So it's not all sunshine and roses. It doesn't always go the way you want. There are all kinds of life occurrences that can throw your journey off course, and that, as a provider, you need to know about and look out for. The data show that about over half the people who start a GLP-1 stop within the first year, in part due to side effects, in part due to loss of insurance in the United States or unaffordability of the medications, although the prices are coming down in the US. And then, as I talked about earlier, about 80% of people regain weight after they stop. So those are issues. And in the adult world, people are experimenting with something called microdosing or intermittent dosing. People aren't really doing that in kids as much, but GLP-1 use in general in kids isn't as widespread as it is in adults. Although I created a pediatric telemedicine practice to try to help that access to care barrier so that more kids can get access to the medications. More kids who need the medications can get access to them. And then, as I talked about with surgery, there's also some weight regain. And while you can do revisional surgery, that's usually not that great for weight loss. It can help with other issues, but like gastroesophageal reflux disease. But in children, we rarely do revisional surgery, but sometimes I actually have repeated sleeve gastrectomies on kids, and I have converted kids to gastric bypass, but again, sort of less common. So what do? You really want to keep your patients engaged. You want to make sure that they feel comfortable coming back to you so that if they do have a weight regain, they're not ashamed and stay away from medical care. So you want to make them feel welcome to talk about these issues. And you don't want to judge them, just like you don't want to judge them when they first come into your office. And you want to be there for them so that you can help figure out how to intervene if they need it. There is some concern about people developing eating disorders after obesity treatment, but actually the data show the opposite, that both children and adults are less likely to develop a eating disorder if they're in an obesity treatment program rather than not being cared for their weight. So it's important to sort of attack any issues or address any issues that may come up along the weight loss journey when they come up, and again, not ignore them or make the patients feel like they can't talk about them, but make them feel welcome, and make sure that they reach out to you or you reach out to them, and encourage your families to contact you if there's anything that comes up: emotional setback, mental health struggle, economic change that makes things more difficult, whatever it may be, because obesity is a chronic disease that requires a lifetime of care. And, the people's paths to metabolic health isn't always linear. It can, have its ups and downs, and you just got to make sure that the overall trend is in the right direction.